Hi, I'm Martha Dunlap, a tobacco treatment specialist with Hollings Cancer Center at the Medical University of South Carolina. I'd like to take this opportunity to congratulate Dr. Michael Cummings. I've worked with Dr. Cummings now for approximately 8 years, and it has been an honor and a privilege. Mike established the tobacco treatment program at the Medical University, ensuring that patients in the emergency department are referred to the South Carolina Tobacco Quit line, that patients who are in the hospital with Hollings Cancer Center clinics are seen at bedside, and that outpatients are receiving telephone counseling to assist with their quitting smoking. Thousands of patients have received assistance each year because of Mike's efforts. Mike spends countless hours in the courtroom testifying against the tobacco industry. We'd like to honor Mike and say congratulations on all your hard work. I know how important it is that all these efforts are occurring to help end the needless suffering of the patients and citizens of South Carolina. Thank you, Mike. We couldn't be prouder of you. Congratulations.
Hi, I'm Sharon Biggers. I previously served as South Carolina's Tobacco Control Program Manager, and now I work with the National Association of Chronic Disease Directors on tobacco cessation. But more importantly, I've had the privilege of working alongside Dr. Mike Cummings and seeing his impact here in South Carolina firsthand. I'm pleased to help celebrate my friend and colleague on the occasion of his retirement. When Dr. Cummings came to the Medical University of South Carolina, he didn't just bring his expertise, he brought momentum. And in a field where we were used to incremental progress, Mike had a habit of making incremental feel just a bit too slow. Over the course of an already distinguished career in tobacco control and cessation, Mike helped shape the field at the national level. But here in South Carolina, his impact was deeply personal and unmistakably transformative. At MUSC, Mike fundamentally changed how health systems approach treating tobacco use. He pushed everyone to recognize tobacco as a chronic condition that deserves consistent, evidence based care. Because of his leadership, tobacco treatment became embedded in clinical workflows, in bedside counseling, and patients were reached in ways that just simply had not happened before. But what really set Mike apart was his tenacity. He has a way of walking into rooms and where people believed that change wasn't possible and leaving behind a team that not only believed it was possible but felt equipped to make it happen. He strengthened the resolve of those who had long been doing this work without the support or the confidence that they deserved and help turn evidence into action across systems. His fingerprints are all over South Carolina's progress in cancer care. Through his leadership in helping launch the South Carolina Can Quit initiative, he helped create a pathway for cancer patients who use tobacco have access to the support that they need, improving not just quitting rates, but treatment outcomes and quality of life. Mike, your work has changed systems, strengthened people, and improved lives across the state. And while retirement marks the close of this chapter, the impact that you've made will continue to show up in clinics, in policies, and in every patient who gets a better chance because of the work that you led. Thank you for everything that you've given to this field and to us. Enjoy your well deserved retirement.
Hello, I'm Matt Carpenter from the Hollings Cancer Center at the Medical University of South Carolina. Everyone knows that Mike Cummings had a long and incredibly successful career at the Roswell Park Cancer Institute that spanned decades and left an indelible impact on public health policy in support of effective and meaningful tobacco control at the local, state, national, and international levels. So when Mike transitioned to MUSC in 2010, we knew we were getting someone special. If anyone thought for a moment that Mike came to South Carolina way back then to test out retirement, that notion was quickly abolished. I don't think anybody actually thought that for one moment. Mike, what you have done here at South Carolina for MUSC, for our tobacco research group, cannot be adequately summed up in a few sentences. You have elevated us all to a higher standard, driven by science and passionately dedicated to the betterment of everyone. If all you did was develop a comprehensive, evidence-based smoking cessation program here at MUSC that just so happens to serve as a model for all health institutions, demonstrating cost-saving value to hospital administrators, if that was all you did, that would be a career unto itself. All future patients here at MUSC System have you to thank for improving their healthcare. But you've done so much more. You saw clarity through the haze of harm reduction and you advocated for it at every level. You continued your trailblazing efforts to elevate tobacco control policies at the highest levels, never losing sight on the impact it has on the lowest levels. You were instrumental to the collective effort at MUSC to strengthen our tobacco research group into an incredibly impactful program that is the envy of many of our colleagues elsewhere. And then on a personal level, I can say that you inspired me and many others to think big and have the conviction to do big things. I don't know anyone else who has the passion for what they do quite like you do. I'm sorry I cannot be here in person with a special event to honor you. It is well deserved. I hope we adequately convey our appreciation for all you've done. But just like 2010, if anyone thinks for a moment that your voice and impact will diminish as you head towards your true retirement, I assure them that it will not. After all, as we've all now witnessed, you simply do not have an off switch. I'm quite confident there's more yet to come, and we'll all be better for it. Thank you.
Hi, my name is Diane Wilson, and I have had the honor and pleasure of working with Dr. Cummings for the past 14 and a half years. He was instrumental in setting up our program at MUSC for cessation services for inpatients and outpatients, one of the very few in the country at the time in a medical setting. To date, we are covering clinics and hospitals across the state, reaching thousands of patients who have never had the opportunity of having cessation services provided to them. It is really essential for these services to be offered in a medical facility, especially since these patients are going through dramatic health issues and can have better outcomes if they can and will stop smoking. Dr. Cummings has set the foundation at MUSC just as he has at other facilities where he has worked. He is still a force to be reckoned with across the country when it comes to tobacco policy and especially as an expert witness in tobacco trials. It has been an honor and a pleasure of working with Dr. Cummings for all these years, and I've learned so much and seen so much of the work that he has done at MUSC. He has set the foundation, and which will be in place hopefully long after he and I have both departed from MUSC. Again, he's very deserving of this award, and I am proud to have been part of the program that he established. Thank you.
My name is Tracy Smith, and I'm an associate professor at the Medical University of South Carolina. I'm excited to share a few comments to celebrate Mike's career and his recognition. Mike has had an extraordinary impact on the field of tobacco control and public health. His work has shaped the science and the policy that surrounds tobacco control both nationally and internationally. He has contributed fundamentally to our understanding of smoking behavior, cessation, tobacco marketing, and the effects of tobacco regulation. His research has informed policy decisions around the world and helped move forward evidence-based interventions that have saved countless lives. He also played a really important role in the release and the analysis of the tobacco industry's internal documents after the Master Settlement Agreement. Those records exposed decades of tobacco industry practices, including marketing aimed at young people and efforts to obscure the addictive nature of cigarettes. The impact of this work on tobacco control and our public understanding of the tobacco industry behavior is really hard to overstate. Mike's passion for tobacco control extends beyond scholarship. It's always been impressive to me how he maintains such compassion for individual people who are addicted to nicotine through his work testifying and his devotion to helping them stop smoking. He designed and supported the tobacco cessation programs in our hospital and our cancer center, and has made sure that the people who smoke in our healthcare system have access to stop smoking medications that can help them and increase the odds that they're able to quit. And he has advocated for those programs at every level of our leadership by showing how effective they can be and ensuring that we have support for those programs that continues. And despite all of these accomplishments, what stands out to me is the kind of colleague and mentor that Mike has been. Personally, Mike has been incredibly generous with his time and his support. He's provided pilot funding that has helped my research program and many other people's research program. He provides thoughtful feedback on grant drafts and research ideas. And what I really appreciate about that is that his feedback is never superficial. He can look at research from new angles and bring a new perspective in situations where nobody else can identify kind of that new angle that Mike brings to the table. Mike's legacy is clearly reflected in his scholarship and the impact that he's had on tobacco control, but I think it's equally reflected in the people that he has supported, encouraged, and mentored throughout his career. So many careers, including mine, are better because of Mike, and it's in this way that his science and perspective will live on beyond his own career. Mike, congratulations on an incredible career and this recognition, and thank you for everything that you've contributed to the field, to MUSC, and to all of us who have had the privilege to work with you.
I want to thank the Smokefree South Carolina board for this special recognition and apologize for not being with you in person today. I had planned to be here, but a tobacco case that has long been in the works, nearly a decade now, finally got their day in court this week. So hopefully, if I do my job, we can extract some justice for another family harmed by the actions of cigarette companies. That said, I'm humbled by this award, which really reflects the collective efforts of those at the Medical University of South Carolina and people like Katie Wynn and Sharon Biggers and others who over the years have supported my vision to advance tobacco cessation service delivery for the patients seen at MUSC facilities. I would like to recognize Diane Wilson, former Smokefree South Carolina board member, and Martha Dunlap, formerly tobacco control employee at DHEC, who were really the ones at MUSC that deserve recognition. I asked Diane and Martha to attend this year's summit to accept this award on my behalf. Diane Wilson helped me build the inpatient program, which we launched in 2014. This program now is operating in 10 MUSC hospitals across South Carolina. Diane also worked with me to develop and refine the telehealth pharmacy-assisted tobacco cessation program for patients in Hollings Cancer Center affiliated oncology clinics. This program now handles about 3,000 referrals a year from over 50 outpatient clinics across the state. Martha Dunlop came aboard to help Diane when the telehealth program took off a number of years ago. With the help of Avery Roberson, one of your Smokefree South Carolina board members, we have just finished a paper describing 5 years of data from our automated emergency department services that connects current smokers who are home discharged from the emergency department to the South Carolina quit line. Our program, which had fewer than 10 referrals to the quit line when I started at MUSC in 2011, now annually sends thousands of patients to the quit line and handles over 20,000 patient referrals annually. Not bad, and a nice model for other healthcare systems in the state to copy. When I had the privilege to serve on the South Carolina Board of Directors, my job was to keep the board and the volunteers across the state focused on the big problem, cigarette smoking. Cigarette smoking is what drives the morbidity and mortality we see from tobacco use. It is nice to see smoking rates declining rapidly in South Carolina and largely eliminated among youth and young adults, but we still have a long way to go to address the continuing unacceptably high smoking prevalence rates among older adults, especially among residents living in high poverty counties across our state. Thanks again for this recognition, and please stand and give a round of applause to the real heroes of today's events, Diane and Martha, who will be retiring from MUSC in July. Thanks again for the recognition and enjoy the summit.